The investigation of speech impairment in children with cleft palate has required the development of very specialised measurement techniques. And this work originally started in 1990 as a joint project at the London Hospital between physics and the Speech and Language Therapy Department. And the original requirement was to look at the quality of speech in terms of an acoustic measurement, to measure the balance between hyper and hypernasality. So that required the development of specialist instrumentation and also led to postdoctoral research in imaging, as it became clear that to be able to image the soft palate of the child during speech has great diagnostic value. So originally this work was done with video fluoroscopy and X-ray technique, and some image analysis techniques were developed to understand the dynamic of the soft palate as it moved. But more recently we've taken advantage of magnetic resonance imaging in order to bring further diagnostic quality to this measurement. So this work has been supported by Bart's charity, which has enabled a full-time postdoctoral research to be undertaken. And also it's been supported by the Cleft charity, which has supported a pre-doctoral PhD student. That work is now being led by Mark McGwell and his PhD student Andreas.
Okay, so in 2009 we obtained a grant from Bart's charity to increase the role of MRI in the management of cleft palate patients. MRI can help in two ways. The first thing you can have with MRI is very detailed anatomy, and especially the musculature involved in speech, that can help the surgeon decide on further surgery. The second thing MRI can do is acquire images during speech, so real-time MRI of speech, in a similar fashion to video fluoroscopy and nasendoscopy that Malcolm discussed just before. Early on, we decided that we will tackle the research in two ways in parallel. The first one is actually to use more or less standard sequences provided by your scanner manufacturer and improve them so we can quickly develop a protocol that could be used in volunteers and in patients. And then the second way is actually to go into more research sequences to obtain better anatomical images and better speech images. So very quickly we managed to develop a 3D protocol to image the musculature, and also we managed to image during speech at roughly 10 frames per second, and the next few images you're going to see are an example of that sort of sequence.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Za na za, zo no zo, zi ni zi, ah.
The second part of the research is to look into more advanced way to image, but also ways to improve the image quality. And one of the early postdocs on this project developed a method called adaptive averaging, which is actually improving the image quality after you acquire them. So not on the scanner, but offline afterwards. And the next 10 seconds are actually an illustration of this process.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Za na zo, zo no zo, zi ni zi, ah, e.
In terms of imaging faster, in 2013 we were successful for a grant application with Cleft, which is a small London-based charity, and we had money to recruit a PhD student whose work is solely dedicated to increasing the speed of the imaging, and this is Andrea who's going to talk now.
As my colleague Mark already mentioned, one of the goals of our project is to improve temporal resolution, or the speed of the imaging, and the quality of the imaging as well. The problem with MRI is that it's a very slow technique to acquire the data. It just takes time, and there's a trade-off between the time it takes to acquire the data and the actual quality of the image in the end. Traditionally, MRI data is acquired in a Cartesian grid, line by line, as you will see on the image that is going to pass as an example. A more recent suggestion to improve temporal resolution and image quality is to use what we call non-Cartesian sampling. And in that case, instead of doing line by line, we can do several other trajectories, like a radial spoke pattern or spiral interleaves, as you will also see in the image as an example. Using those techniques, we can improve temporal resolution and image quality, but they are more complex to implement and they are more complex also to reconstruct. So our work at the moment is based on using those techniques and implement them in a way that it can work to then after do the clinical assessment of the patients. In addition, besides improving temporal resolution or image quality, we can also use these new methods of sampling, the non-Cartesian, to start thinking about doing dynamic imaging in multiple planes, like for example several sagittal slices instead of just one, and that will give us additional information about the patient assessment. So the videos you are going to see after are examples of what we have currently implemented in the scanner. You will see, for example, a video acquired at 10 frames per second with the traditional Cartesian grid, and you will also see what we have developed, which is a spiral sampling at 20 frames per second, so already with an improvement in terms of temporal resolution.
So, to conclude, this project has been very successful up to now. There's still a lot of work to do, but it also allowed us to start collaboration with different groups. So, for example, we've been working with groups in the States on a recommendation paper for people who want to start doing real-time imaging of speech. We are also working with a group at the Royal Holloway who are combining functional MRI and real-time MRI. And we started talking to linguists because you can actually see the articulations really well when you do that sort of imaging. And just to finish, if you're interested, we also did a music video with Adam Pyle, and you can have a look at it. It's Si Vous, Better Man Than He.